So, welcome back to this week's latest Q&A with Public Health. Steve, did you just want to introduce yourself?
Yes, I'm Steve Pintus. I am the Director of Public Health for North East Lincolnshire.
Okay, so I'll dive straight in with the questions then. This morning, a vaccine has been approved for use by Britain's medical regulator, the MHRA. It can be rolled out from next week. In reality, when are people in our patch going to see this?
So yeah, thanks. This is a really important milestone, and it's certainly got people very excited. Clearly, the nature of this first vaccine is that it is quite restrictive in terms of its movement, and therefore the numbers of vaccines available this side of Christmas is quite limited. Because of the need to keep the vaccine stable. So the focus will be on the highest priority groups in the priority list, particularly those over 80, and of course frontline healthcare staff. So the numbers this side of Christmas will be quite limited. The full rollout of the vaccine programme and the anticipated coming online of the other vaccines that are awaiting licensing by the authority will come online later on in the new year. And we should really be thinking about a vaccination programme that will run well into the spring as it works its way through the different priority groups before it reaches the wider population.
And I suppose one to follow on from that really is that we're seeing a lot of reaction and feedback from the public on social media and sort of, on the street and out and about. There's a lot of skepticism about these vaccines, how quickly that it seems they've been developed. Is this skepticism warranted?
Well, there's always healthy skepticism, right? But I think the level of resource and capacity put into the development of these vaccines globally has been unprecedented. What people can take assurance from is that the Medicines Authority would not pass anything that didn't pass their stringent safety measures. And that's what everyone's been waiting for, because that's when we understand what the side effects, if there are any side effects, potential side effects are for anyone being given the vaccine, and they would not license anything that was unsafe. So the public, the frontline workforce, relatives of the elderly that may be prioritised can be assured that the licence is not being rushed. It's been very considered. And they have to think about their reputation in terms of making sure that all the guidance is followed.
Okay, moving on from vaccines then, we are obviously entering the festive period. Lots of people have got their lights up already. People will be wanting to go out shopping. Can people travel outside of NEL to another tier 3 authority, for example, Hull, to go shopping? Is that something they can do?
No, I think the guidance is fairly clear, that in the very high tier 3, we're supposed to restrict our travel and restrict our going out. So whilst it's great and we'd encourage people to support their local shops, we would discourage, and the guidance discourages people from travelling out of their area, and by area we tend to mean their local authority area.
Okay, and following on from that question about the festive season, Christmas is obviously a time for coming together with your families. These restrictions obviously make that quite difficult, but the Prime Minister has said that there will be changes in December to the restrictions. What are we clear about what that means for people?
Well, there's further guidance to follow, I'm fairly sure, but I think if we take what the Prime Minister announced, then people have a window of opportunity to create a new Christmas bubble. that Christmas bubble is to be made up of 3 households. I think what we will be waiting for is further clarity, but the initial interpretation is that they have to be the same 3 households for that period. Unfortunately, I don't think we can encourage people to join multiple bubbles. So it will present some dilemmas, particularly to larger families who may have to make difficult choices about which 3 households they include in their bubble. But that is the current guidance as it stands.
Okay, Steve Pintus, thank you.
Pleasure.